Okay, so this is the schedule for the day. And to enter the notes from the doctor, we're gonna go right here and click on doctor. And it should take you to this dashboard, and these are the patients that have checked in already. Okay, so let's go to Nisha, for example. Okay, the first thing you're gonna look in this list is to this area where it says sorry. Okay, and here we're gonna record how the patient is doing. This is in the words that the patient tell the doctor. Okay, so today she say that she is improving and had no pain on mid or low back for the first time. Oops. First time since starting treatment. Okay, so once we get that recorded, we're always gonna go down here where it says chiropractic techniques, and we're gonna import here on the top. We're gonna import from last visit, so this will come to today's date. Okay, this is the one we usually keep open for the doctor to see what he have done in the past, so this guides him today in the adjustment. Okay, here modalities is telling us what therapies she have done. Okay, and if we're gonna do a therapy for today, so for example today she have taping, so we're gonna click here. Okay, and then we're gonna go here. If you see here in the bottom, it has all the dates that we have done the therapy, where, like the area where we did it, and who was the practitioner that completed. Okay, so here we're gonna go to the end, and we're gonna add, first thing we do is to add the date. So today's date and the area. Today we did her mid back, was the area that we taped, and I did it, so it's gonna be my initials right there. Okay, so then we're gonna click here where it say perform, and we're done for that encounter. Okay, then we're gonna go return to the visit summary here. It's gonna take us back into this page. Okay, and to complete the encounter, we're gonna go to super bill, and here we're gonna start choosing all the therapies that we did today. Okay, so today we didn't do anything from this area, so we're gonna cancel. We did traction, so that one is highlighted. We're gonna select here in the bottom. Okay, we didn't do anything from this list, so we're gonna cancel. We didn't do shockwave today, so we're gonna cancel. And we're gonna go here, and here is the list of the therapies that she had today. Okay, so we have an adjustment, we have the tape, we have traction, and here this is carrying from another visit. We didn't do infrared, so we're gonna go here and delete that one. Okay, are you sure you want to delete? Yes. Okay, then the last step for here, we're gonna go, we have to pair the service that we did with the correct diagnosis here. These are the list of the diagnoses that we have chosen for her. Okay, so for the adjustment, here is highlighted already. You see that we work in her lumbar area, thoracic, cervical area, so that is what is, like telling the system the reason why we did this service. Okay, then we're gonna go and click on the second service. It was tape. We did it. It's already highlighted, pain the thoracic, but let's say it wasn't highlighted and it's showing like this. We have to look in that list and click on the reason. Okay, the doctor will be telling you, like how to point the service to a diagnosis. Okay, and then the last one is traction, and it's already highlighted and it is correct. That's the reason why we did it. Okay, once we got all that done, we go and sign and complete, and that will complete the transaction for her for the day. Okay, we can go back here and refresh, and you see that her name is no longer here. Okay, so from there, the next step will be on the front. Remember that we use these forms. Do you have Nisha here? Oh, let me get the one for the patient that we just completed so you see. Okay, so these are the form that we have for her today. It says exactly what we did, like this service. This was the adjustment, the decompression, the tape, and this is what Bernice received on the front. That is, with the communication of what we did, so she knew exactly how to charge for it. And at the end of the day, when she is reconciling all the services and charges, she's gonna have these to review that everything was correct. Okay, but later we're gonna be teaching you, how to do the front. But for now, I just wanted for you to see and have a better idea of how to do that, the note in the room with the doctor. Okay, I hope this helped, and I'm looking forward to helping you with it more on Monday. All right, see you soon.